Hey, it's Joanna. I'm here to talk to you about my written situation. The story I'm going to tell happened several years ago. Throughout my career, I've been a nurse for 27 years. I've had a few patients that have really stuck out in my mind and that I carry with me to this day. I spent about 15 years in the cardiac surgery intensive care unit, working at the bedside, and every day we spent so much time taking care of patients and doing everything we could to help them recover. The ones that I was always challenged with were the ones that didn't want to recover and that we had to withdraw care per their family's request. Most of the time that request never came from the patient. In this particular patient that I remember so clearly, she had requested that we withdraw care and let her pass away peacefully. So the day that I went to work and this happened, it was a crazy sunny day. I'm not really sure what time of the year it was because I don't remember that, but I do remember the sun coming in the windows of her room. I had gotten to work on day shift, rushed in, running late, checked my assignment, found out that I was singled. Most of our nurses on that unit, we took care of 2 patients at a time. That was our max. So if you had one patient, a lot of fear usually set in, at least for me, because I worried, the patient must be so sick now that they can't give me 2 patients. So I fully expected to find a very sick patient on a lot of drips, intubated, potentially bleeding. They were generally the patients that were singled. So I walk down the hall, I peek in the room, and I find the patient. She's sleeping. She has a BiPAP mask on, attached to the ventilator, so it's humming with each breath. Shades are drawn, but the bright sunlight's pouring into the room. I find the nurse who had been caring for her overnight. We'll just call her Mrs. Smith. And she gives me a report, and she shares that the patient had been struggling for several days with rising CO2s and respiratory failure. She adamantly did not want to be re-intubated. She had already been intubated and extubated several times, knowing full well that if she was not intubated, that it would likely be her demise and that she would pass away. And she had also been prolonged illness for quite a while, and so she had decided that she did not want to be put back on the ventilator, that she wanted her family with her, and they would take her off the BiPAP, let her CO2 rise. Our intensivists felt pretty strongly that, it would just, her CO2 would rise and she would become somnolent and pass away. We would also assist her and give her some, a little bit of morphine, a little bit of comfort medication. But she was adamant that she wanted this to happen. She did not want to go back on the ventilator, and she wanted her family with her. So they had made arrangements the day before to do this when her family all arrived. Her children were coming, her husband was coming. So I immediately thought, well, this is really strange. I had never had this type of experience where the patient was directing her withdrawal of care. So I started thinking what I needed to do for her to get her ready for that, and also what I was going to have to do for the family. I didn't know how they felt about this big decision, that their wife and their mother and grandmother would be passing away this day. So after report, I went into the room. The shades were drawn. There was light coming in. Bright sunny day. It was super quiet. She was very comfortable. She was, the nurse at night had, cleaned her up, did her bath, clean sheets. She looked pristine in the bed. She had her BiPAP mask on. And so I took that off, and to talk with her for a few minutes before I went on with the day, because I wanted to get my assessment in. She was very coherent. She was clear on her plan. I had never had a patient talk to me that knowing full well, and she said, I know I'm going to die today. So I continued on. I did my assessment. I charted. We had the BiPAP mask put back on so that she would be alert and coherent when her family got there. Family got there. Her husband came in so calm, Her children came in really calm. Again, it's perfectly quiet in the room. Lights were dim. Sun coming in through the sides of the shades hanging down on the window. I let them have some privacy so they could all talk, and we took off the BiPAP mask, and she did okay for a little while. And then she, her oxygen sats started to drop a little bit. Her respiratory rate went up a little bit, but still very calm. It was peaceful. It was quiet. I had turned down the monitor alarms so they wouldn't go off in the room. I pulled the curtain. I sat outside, watched through the window, and waited. The whole time, I'm still thinking this is just the strangest thing because I've never experienced this. We go above and beyond to save people's lives, and this time we're going above and beyond for her to peacefully pass. So as the day went on, she passed away like about mid-afternoon. I forget what time it was, but it was mid-afternoon. Her family was with her. It was very peaceful. Her sats had dropped. She became somnolent. Just slowly passed away. Honestly, not a bad way to go. So the family stayed by her side. They were not tearful. They were almost kind of like at peace, and they were talking, and they were hugging each other. So when it came time for me to come in the room, I was just visibly shook up by the whole thing. And because I was sitting there thinking, I've had this conversation with this lady in the morning, and now she has passed away. And it just didn't feel normal to me. And her husband, they thanked me. They thanked me for making sure that they had the peace and the calm that they wanted for her to pass. And, of course I was happy that I was able to do that for them. It felt like really minuscule what I had done, that I felt like I could have done so much more, because on so many occasions in my career, when you are trying to comfort someone while a loved one is passing away, it's usually much more stressful, especially in the ICU. It's more loud, it's more, intrusive almost, not calm and peaceful. This was almost like a hospice setting, or at home. And yet I was so unsettled. And the husband, and he just looked at me, and I was the one who was tearful. The family wasn't very tearful. I was tearful, and they were comforting me and telling me it's okay. The staff here has done so well by her. So I went in, and I after they left, and to clean her up and prepare her to take her down to the morgue. And again, it's bright and sunny outside, and I thought, it's a beautiful day to die. But still, I'll never forget that moment of taking care of that lady. And then we packed her up, we took her downstairs, and that was that. But now that I've taken this class and I've looked at the caring piece and the theories behind caring and being present, I was present. I did everything, I think, the right way for this lady. I made it so that she had what she wanted, her family had what they wanted, and she passed peacefully. And I think that's all we can all hope for in life. Thank you.